week ago with the vaginal discharge, how it would come like, they might give you the result of discharge, and that will show bacterial vaginosis. Then what question you need to ask are here. What are the red flags, offensive grayish fishy smell, and everything being taught to you? So in this way, you will read this ebook and you'll go through that all of the scenario, which we already taught you. Trichomonas vaginalis, again, then the patient might come with these presentation, pruritus, vaginal discharge. But how you will rule out how to use this ebook, you need to read important thing. What important thing? What could be the possible findings, and what could be the possible things you will do in examination, like vaginal pH will differentiate bacterial vaginosis from other one. So you already gone through treatment, again the same, but you haven't seen it up till now. But in future, most of the things would be similar, like advise safe sex, avoid doing this. You can read through that ebook. But what you need to do, the previously which was coming and the PLAB 2 examination, like pelvic inflammatory disease is very common. Most of your preparation should be focused on your previously coming topic, but you will go through the new topics which we have added on that ebook. So this ebook is just a reference ebook, but to practice more is that we also creating a pool algorithms which will include all the presentations. So what you need to know that if you find anything which is very familiar to the PLAB 2 examinations previously, and you've been seeing in the different recalls, that 100% okay, you do it more focused. But if you don't find any topic from the notes or from the recalls, this ebook would be the reference, because if you need to search that topic on the CKS and everything, that will take a lot of time. For example, let's say you're preparing for the MLA and you got to know that these presentations are coming. What you need to do, you go to this ebook and you'll see what are the possible things, because it's already being ready, rather than you searching on the Google CKS guideline. It is already been done from the CKS guideline, NHS guideline. So you will go on that and you will try to focus on the presentations from the MLA content map. The good thing about the ebook is that this is according to the MLA content map. So again, syphilis, the presentation would be genital ulcer, how to use it, read the DDs, examinations, what examination you would do, what diagnosis could be, what would be the management plan straight away. If woman coming in the pregnancy with a rash, how would you do that? Just few lines we are given to you according to the PLAB 2, according to the delivery. This is what you need to do here. Rather than just Googling it, rather than just finding out already here, what are the communication skills you need, tools you need to do, and all of things are here in that ebook. And if you need that ebook, you just need to send us message, we'll give you. Again, gonorrhea, what would be the possible presentation, follow-up case, discharge. So if it's a discharge, how would you do that? If it's not, then A24 come to the clinic for her investigation, results has been taken and result shows gonorrhea. So how would you do that? We already shown it yesterday, last time, that how to deliver that information, and we'll be doing it today as well. So I'm just trying to tell you how to use this ebook. So past medical history, period, pap smear, partner, that would be here. You will take that history. We've been doing it for from yesterday. So you'll take that history. How to take that history is there. If everything is here. Communication tool, how to ask guys, everything here. Possible finding, test STI, because read is somewhere last menstrual period 2 weeks ago. So you would test them STI. What could be the possible finding? What could be the vital signs? So we created that in a way. And again, how to treat that patient. So this is all written in the management. If chlamydia infection is there for the child health, in which the child might have chlamydia, and then having a follow-up consultation, how you are going to manage that. So you will have a possible case like 18-year-old male appointment to see you. She delivered a baby 10 days ago who had a red sticky eyes for the last 3 days. Swab has been taken. We are going to do that scenario anyway today, and I will tell you how to do that, what medication was given. It's written. So there would be 3 different presenting complaints, how you are going to manage in that. That is very important for today. Maybe with Sony we will do that one. So this is how you would do, and how would you explain, and very short management is written here, what to do, what not to do. This is very straightforward. Then coming to the cervical cancer, so what could be the possible presentation, you have to read it up abnormal vaginal bleeding, you will do all your DDs, you will get possible findings, and you will use that here. And again, endometrial cancer, it is not previously been seen in any of the exam, but you'll need to know what is endometriosis, what is fibroids. You should have an idea, you might have idea, but if it shows up if your exam is after 17th May, you will be prepared. Even you will get to know that these scenarios are coming, these scenarios, the new scenarios every day coming. So you will at least be exposed to 1 or 2 pages where you will understand that what we'll do. Again, with ovarian cancer, you will get some short information that what it is. So you will get that presentation and you will make read like a DD that will help you to build your knowledge, even if they are changing, they are adding more scenarios even. So again, cervical screening, lesbian cervical screening, it's coming. Or how you are going to do that. If someone is having they want to ask why it is done, the possible cases are here. 25-year-old female come to you with concern, and 26-year-old female come to you with the concern, how to deal with that. So you just need to go through it, and you need to practice. That this is what you need to do. So it's all here, questions are here, diagnosis is here, management is here, and this is how you will do. Again, placenta previa haven't came, but presentation would be bleeding. So you will see if the patient is what part of pregnancy his patient is, how you are going to do that. Again, placental abruption here, you need to know that what would be the presenting. At least, even you see a new scenario in which you see abdominal pain and PV bleed, you would have an at least idea that it is placental abruption, and what are the possible finding and examination, what you need to do. Even if you're going to see a new scenario from that, you will do that. In the same man, you are seeing that the new scenarios are coming in which postpartum hemorrhage and the morphine, C-section pain, if they are going to put, for example, placental abruption, or they are going to put any emergency scenario, at least you have a very short, brief notes to review it. You review it, and again, as will go in a very sequence. And again, with the termination of pregnancy, you will see, you will ask all those questions. So just need to go through these things so that you will have an idea how to do that. Again, preeclampsia has been seen, hypertension, headache, these are possible findings. So you will get to know what are the possible findings for preeclampsia, you might say, or what will be the possible cases you might see. So you will read those information, and when you'll be reading it, you do in practice, how you will be practicing all of these cases. So this is very important. And again, in diabetes, you will see that could be a follow-up consultation, and pee more than usual. So what you will do, you will read